Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about dissociative amnesia. In this video, we'll first look at what dissociative amnesia is. We'll then look at the risk factors and causes, the different types of dissociative amnesia, the symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Dissociative amnesia is a mental health condition characterized by an inability to remember important personal information that would not typically occur with ordinary forgetting. A person may forget specific areas of their life or much of their life history and/or identity. In rare occurrences, a person can forget most or all of their personal information and may relocate and create a new identity. This is referred to as dissociative fugue. Dissociative amnesia is one of the dissociative disorders that involve disruption and/or a break in consciousness, memory, emotion, identity, perception, and behavior. The symptoms can range from mild to severe, to a point in which a person has difficulty functioning. This disorder has been found to affect approximately 1% of men and 2.6% of women in the United States. Risk factors and causes. Studies suggest that the development of dissociative amnesia may be linked to genetics. Dissociative amnesia has also been linked to traumatic or stressful experiences, such as physical or sexual abuse, war, genocide, a death of a loved one, and financial issues. Types of dissociative amnesia. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, there are different types of amnesia, including localized amnesia, which involves the inability to recall specific events or a series of events during a period of time, creating a memory gap. Selective amnesia involves losing some parts of one's memory for a certain period of time. Continuous amnesia involves loss of memory for new events as they occur. Systematized amnesia includes a loss of memory about a specific category of information or individuals. Generalized amnesia is a rare occurrence in which a person loses their memory about their identity and life experiences. This is common in sexual assault survivors and war veterans. Dissociative fugue is another rare form that involves memory loss, relocation, and the adoption of a new identity. Symptoms. The main symptom of dissociative amnesia includes memory loss regarding one's personal information and forgetting certain time periods in one's life. Other symptoms include feeling detached from oneself, one's emotions, and other people, disruption in one's daily functioning. Effects. People with dissociative disorders have a higher risk of developing the following complications or comorbid disorders: occupational difficulties, relationship issues, anxiety disorder, depression disorder, post-traumatic stress disorder, personality disorder, sleep disorder such as insomnia, eating disorder, alcohol use disorder, drug use disorder, self-harm, and suicidal ideation. Treatment. Treatment for dissociative disorder is aimed at the recovery of a person's memories, which involves helping a person deal with the consequences of the traumatic events that caused their amnesia. Treatment for this disorder can depend on the severity of one's condition and their co-occurring disorders. Psychotherapy is a common way to treat dissociative amnesia. The types of psychotherapy can include cognitive behavioral therapy, which helps people understand and change their thoughts, feelings, and behaviors. Psychodynamic therapy helps people discover their unconscious dynamics that cause their symptoms and distress. Dialectical behavioral therapy helps people learn coping strategies to manage destructive thoughts and manage their emotions. Family therapy involves psychoeducation and teaching family members how to recognize symptoms, as well as how to help their loved ones cope with their condition. Creative therapy can include art therapy or music therapy, which can help people examine uncomfortable emotions through a comfortable medium and environment. Medication such as anti-anxiety medication or antidepressants may also be prescribed by a doctor for other co-occurring conditions such as anxiety or depression disorder. Coping strategies. There are a few coping strategies that can help a person on their journey to recovery. A person with dissociative amnesia can journal daily to track details about events and people, check one's calendar for past appointments to be confident that they have occurred, develop a support system and communicate with family members or friends to gain emotional support, engage in mindfulness such as deep breathing exercises, engage in self-care activities such as eating healthy and exercising, and being kind to oneself. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.